presenter is from HERA. And I'd like to introduce Caitlyn Hoeflin. Next slide, please, Justin. Who has a background in quantitative research, and she's very excited to talk to you today about global health. Caitlyn, the floor is yours now. So if you could advance to the next slide, please, Justin.
Yeah, hi, my name is Caitlyn Hoeflin, and I'm part of the founding team over here at HERA. And today I want to talk to you about how we protect and improve the quality of life of refugee women. We are a mission-based, socially responsible business that provides free health services to our users, who are all refugee women, by partnering with governmental agencies, NGOs, and insurance carriers. We're seeking at least $300,000 in grant funding, as well as introductions to partners who are interested in global health and refugee care. So we know from the research that women and babies who are forcibly displaced from their homes are about 60 times more likely to die. And we've known for a long time how to save these women and children. Women need prenatal care. They need a safe place to give birth. Many of us are able to take pregnancy care for granted, but in refugee situations, this can be a matter of life and death. Around the world, there are almost 80 million people who are forcibly displaced. They don't have access to health care, and they die from completely preventable causes. Next slide, please. To understand how this happens, let's talk about Aisha. Aisha is a Syrian refugee who lives in Turkey. She's pregnant, and she has 2 young children under the age of 2. In Turkey, refugees have access to national healthcare systems, but there are many barriers that stop Aisha from getting care. For one, she's got a lot of competing demands. She's trying to find work, she's trying to find a place to live, and she's trying to find a place for her children to go to school. Like a lot of Syrian refugees, she's very mobile. She's traveling between cities as she looks for work. Aisha's also afraid. She's worried that if she goes to the hospital, she might be deported, and she's frightened that something could happen to her family. Because she was forcibly displaced, Aisha also doesn't have her medical records. She doesn't have her children's medical records either. In fact, HERA has found that refugee children can receive the same vaccine as many as 6 times. Aisha doesn't understand how the Turkish medical system works. She doesn't know where to go for routine care or how to get checkups. And then even if she does get to a treatment center, Aisha is going to encounter language barriers. She speaks Arabic and the doctors speak Turkish, so it's hard for her to communicate what the issue is. Next slide, please. In response to people like Aisha, we have created the HERA app. What we do is we connect people with the healthcare they need. For today's presentation, I'm going to be showing you the app in English, but it is delivered in Turkish and Arabic. We know that cell phones are no longer a luxury item. They are a lifeline and a necessity for refugees around the world. In fact, in our own research, we found that 80% of refugees in Turkey have access to a cell phone. So when we were thinking about how to serve refugee women better, it made sense to design a mobile solution. We're currently conducting a long-term study with 300 of our original users, but we have a few hundred additional users as well. And our app is and always will be completely free to our users. So what we do is this. We help women schedule healthcare appointments. We send them reminder messages when their appointments are coming up. And we know from research that reminder messages are a great way to help pregnant women attend prenatal appointments. Aisha's reminded of any prenatal appointment she has coming up. HERA also contains general information for women about the pregnancy. It is information on pregnancy nutrition, childcare, and general health. If at any point during or after her pregnancy, Aisha has questions or concerns, she can go to HERA for a quick, reliable answer. Our app also provides a safe and encrypted space for refugees to store their health records. This way, even if Aisha has to leave suddenly, she still has access to her records and her kids' records. And finally, we help users locate nearby places to get care. And should the worst happen, Aisha can see a map of nearby hospitals, and she can use HERA to call emergency services. Next slide, please. So we designed HERA to be modular so that we could change it according to community needs. And our first real-time demonstration of this has been with the COVID pandemic. We know that refugees, especially refugee women, are particularly vulnerable to pandemics. This is because they may not have access to sanitation, such as hand washing, or they may not be able to socially distance. So what we've been doing is we've been able to provide information about COVID with our users, and we've been able to track their symptoms. Because this population is so highly mobile and hard to access, this would have been completely impossible prior to HERA. And while this has been a real-time demonstration of HERA's flexibility, there's a lot of other ways we can go with this. So many of our refugee women have medical needs that could be addressed with HERA. These include chronic diseases like diabetes or high blood pressure or mental health issues, which we know are extremely common among Syrian refugees. Our current larger user base is in Turkey, and we have been able to hold many workshops in which we help women download and navigate the app. While COVID-19 has made this impossible for now, we are continuing to do outreach through our social media. Next slide, please. So we know that there's really a worldwide need for an app like HERA. There are 80 million people who are forcibly displaced today, and the United Nations estimates that there could be as many as 200 million people who are displaced by the year 2050, which is really not that far away. By our estimates, and this is on the conservative side, at least 78 billion is spent annually on refugee healthcare. This includes spending by governmental agencies, NGOs, and health systems in the countries we serve. HERA operates like an NGO, but for sustainability reasons, we are structured as a for-profit. HERA is always available free to our refugee users. We decided early on that we did not want to be dependent on grant cycles. So now that we've completed our proof of concept, our plan is to partner with ministries of health, NGOs, and insurance agencies. What we can do is we can provide value to them by helping them save money on their care modules. To see how this works, we can talk about a world without HERA. So in this world, we have a governmental agency, the Ministry of Health, that's responsible for the cost of refugee healthcare in an entire country. The ministry is spending a lot because refugees are not accessing healthcare until it's an emergency. And we know that it's a lot cheaper to find an issue during a routine prenatal examination and to treat it then than it is to find that same issue when you are rushing a woman in her 3rd trimester to the hospital to receive emergency care. The end result is that the ministry is spending a lot of money and there are poor patient outcomes. Now, in contrast, we can talk about a world with HERA. Because it's so much cheaper to do preventative care than to provide emergency treatment, our hypothetical Ministry of Health reaches out to HERA. They partner with us to localize the app to their country. So we change the language, we update the modules to be relevant to the local community, and we train the Ministry of Health in how to use and distribute the app. Now, the ministry is treating patients before they're in emergencies. Patients are happier and healthier, and the Ministry of Health is spending less money and getting better results. We know that governments and NGOs around the world are looking for a way to lower their costs, and HERA can help them do just that. Next slide, please. We have had a lot of traction so far. So just for some perspective, HERA is a relatively new app. We were founded in mid-2018, mostly by a group of graduate students at the Harvard School of Public Health. So far, HERA 1.0 is fully developed, and we've been awarded $110,000 in prize money. We currently have 3 published papers on our efficacy, and if you ask me in a month or 2, it could be 5. We're getting some really great traction there. And along the way, we've had the support of a lot of great institutions. This includes Harvard Innovation Labs, the European Investment Bank, Grand Challenges Canada, and Boston Children's Hospital. Thank you. Next slide. With regard to competitors, HERA really is the only truly comprehensive reminder and medical app that's aimed at refugees. What we do is we address the specific barriers that are stopping refugee women from getting care, like language or fear of deportation. Our users are empowered to seek medical care. Next slide. We have a diverse team of doctors who make sure that HERA is medically sound and keep us up to date on the latest research. We also have business operations professionals who are making sure that this whole thing is running smoothly. We all met because of our shared passion for refugee care, and we all love what we do. Next slide. And while we are still very early on in our journey, we have considered future options. So we might one day choose to partner with a global health organization, with an insurance agency, or with a refugee advocacy agency, like the United Nations High Commissioner on Refugees. So far, we've been awarded numerous awards, and these include a grant from Grand Challenges Canada, as well as the Audience Choice Award from the European Investment Bank. Next slide, please. So now that you've learned a bit about HERA, I want to talk about what's coming next. We are seeking $300,000 in seed funding. We want to use this money to expand our largest existing user base in Turkey. We're also looking for introductions to NGOs and other potential partners on our journey. We want to conduct 2 rigorous proof of concept studies, and we are laying the groundwork for this in Bangladesh, Pakistan, and Greece right now. We truly believe that HERA should be expanded to as many countries as possible. And finally, we want to take what we've learned from our users and use it to develop Kibble, HERA 2.0. This will be a stronger, more streamlined version of HERA that's available to non-smartphones. Next slide, please. Yeah, so that about wraps us up. Thank you very much for this opportunity. It's been an honor to present to you today.
Thank you, Caitlin. Wonderful job. We now will have 5 minutes from our judges. And Ambreen, you have the first question, please.
Sure. Caitlin, first of all, thank you so much for this presentation. I wholeheartedly appreciate the concept behind it, where healthcare is a right, not a privilege. And it really rings true to the work that we do at Planned Parenthood as well. My question to you is, and this is something we encounter as a nonprofit as well for many women, which is transportation is a really big barrier. Transportation is a barrier in terms of time, in terms of cost. And it also, you know, the other thing is that if done right, it's a precautionary and safer measure. And so, I mean, I'm only focused on the United States in the particular work that I do, but I would love to hear if that's something that you hear from the patients or the users that are using HERA in particular, and what your thoughts are about that, because that's our biggest barrier, honestly.
Yeah, that's a really excellent point, and that is an issue that we run into. What we've been doing so far is we have been conducting workshops within the community. So we've been going out and trying to get as close to our users as possible, but it still isn't ideal. We're currently actually looking into a conditional cash transfer program in which we pay users a small amount of money to get on the bus, like basically bus fees. So it's less of a missed opportunity for them. But this is unfortunately a little bit early in the works because we're talking about a minority population in a larger area. If we start giving out money, there can be some issues with xenophobia on that front. So it is an issue we are confronting and trying to deal with. And I'm optimistic that there are some good ways forward, but it's a very serious issue.
Great, thank you, Caitlin. And we have a question from Nadine.
Hi, Caitlin. Thank you very much for the presentation. Can you talk a little bit about the health literacy rates in Turkey and how HERA will contribute to that?
Yeah, so I can take so this isn't something I've got statistics at the ready for, but we do know that, so Syria prior to the civil war beginning in 2011 was a very developed country, a very educated country, and a very well vaccinated country. I'm not too much familiar with the current literacy rate, but I do know that in terms of vaccinations, we've gone from something like 80+% coverage to in some areas as little as 25 to 50% coverage for full vaccinations for children. So I imagine that health literacy might go a bit in step with that.
Yeah, it's just something to think about and consider as well as you move forward and across the age groups
definitely.
to check out the health rates. Thank you.
Great, thank you. And now we have a question from Lily.
Hi, Caitlin. This is great. I have a MPH myself, so really interested in these issues. So I actually have a question, and you mentioned earlier sort of rolling this out, and it's dependent on having a smartphone. Is that correct?
Currently it is. We are working to develop a version that it actually works on a non-smartphone and would just be sending SMSs to the user, which is our main functionality.
Right. And so are there any programs have you ever considered working with any programs are there any programs that hand out free smartphones to refugees and partnering with them? Has that been something that you've looked at?
We have been talking to, we've been looking to partner potentially with Turkcell, which is one of the largest cell organizations in Turkey. And that actually speaks very well to an earlier point, is one of our particular ways of potentially helping people get to appointments and avoid missed opportunity costs is instead of giving out cash, working with Turkcell to give out free data in exchange for people attending. So yeah, that is a thing we'd be very interested in talking about, within Turkey or beyond Turkey.
Yeah, and then sorry, my second question is you're going to have to adapt it for different countries, right? Because of language issues and what access to services they might have. And so how difficult do you think that will be to go from country to country in terms of?
It will depend a bit on which country we're entering. For countries that have similar health systems, socialized medicine, there's a little bit more similarity. Language is really not an issue we face. It's a pretty easy to translate app that isn't a challenge we've really had. But if we're moving to a country that has a very similar system to Turkey, that's going to be a pretty easy jump. If we're moving to a country like the United States, which we are very interested in the issues here, just because it is such a different healthcare system, that's a little bit more of a change.
Great, thank you.
Great, thank you so much. And we're moving now